students. I'm going to share my screen so we can break down your career.
Thank you for the intro.
Of course. And I could go on and on. Bring this up. All right, Dr. Salinas, can I get a thumbs up from you if you can see the screen okay?
Thumbs up.
Perfect, perfect. Students, as I mentioned, Dr. Salinas has a lot of initials after his name, and we wanted to make sure and break this down for you because I know you joined tonight and you saw Dr. Salinas. Good, I have been waiting to hear from a doctor. I've wanted to be a doctor my whole life. And my first question to you after that would be, fantastic, what type of doctor? Because there's over 100 different specialties within the physician field. So you're going to have to do some research and you're going to have to narrow down what kind of specialty do you want as a physician. With Dr. Salinas, we're going to break this down. We're going to start at the top with the overreaching area, which is public health. And that's why I put this on the screen for you. Public health is what we all do as a community to keep each other healthy. A public health professional is someone that is dedicated to preventing disease from happening. This is different from a doctor that sees patients when they get sick. A public health professional tries to discover what happened before they got sick and what can be done to avoid it in the future. One example right now, the very big example that we've all been living under since approximately March of 2020 is COVID-19. Public health, this is a huge area. Like the investigators of the health world had to try and figure out, where did this come from? How are people getting this disease? What can be done about it? How is it spreading? So public health is this overarching specialty. When we're drilling down for Dr. Salinas' career, maternal and child health, now some of you on the call were able to join us a couple of months ago when we had a maternal and child health nurse practitioner on. So you might recall that this is a specialization of public health which focuses on the health of mothers, fathers, and children. Now, epidemiology is the branch of medicine which deals with the incidence, distribution, and possible control of diseases and other factors relating to health. So when we put them all together, maternal and child health epidemiology concentration is for individuals who want to pursue public health research and practice that focuses on impacting the well-being of mothers, fathers, children, and families. So that being said, thinking about that, and I wonder what kind of research they might do, I'm going to launch a poll for you. Be prepared, you're going to see it come on your screen. Here it is. You should now see the poll on your screen. I'd like for you to go ahead and read that over as to what types of research might a maternal and child health epidemiology scientist conduct. Read through all of those and give me your best answer. You have just a couple more that need to vote. I'm excited to see what everybody has to say. Okay, I'm going to go ahead and post the results. I tell you what, I have some of the smartest students come onto these career chats. Look at this, all the above and more. So Dr. Salinas, seeing some of these options for research, can you share with us what are some of the topics of research that you've done throughout your career?
Yeah, absolutely. Is it possible for me to share a screen? I just have one.
Absolutely. Let me do this here.
Okay. Okay, let me try this. This looks like I can do it. Could share the screen too.
Ah, it's coming up.
Um, um, at this moment, what you should be seeing is what's in a name. Um, can you see that purple screen? What's in a name? Great. And this is a link that I'll share with you, publicly available. What is Maternal and Child Health by Charlotte Noble, who's a graduate at MCH. She's now Dr. Charlotte Noble. Maternal and Child Health. And I'd like to introduce this field to everyone who's interested. What is that stuff about maternal and child health? Mothers and children, the health of mothers and children, but it's beyond just that. And I'd like to mention a little bit about what we do. My initial training, it's in medicine, um, specialized in pediatrics. But when I was doing pediatrics, I was always seeing the same families again and again, kind of pretty much every month. Um, Same children getting sick. The mothers were also feeling complaints, and I got frustrated and said, like, what's going on with these families? Again, every month, pretty much they come, and I became interested in learning what caused disease in the community so we can prevent it from happening. And that is really at the core of maternal and child health. So, how can we change and improve our lives, everything that we do as society to protect the health of mothers and fathers and children? So, um, in terms of maternal and child health, um, it's a specialization of a broader approach called public health, which is what we do as society to keep the public healthy. So doctors, in clinical doctors like pediatricians or family practice physicians, they do not keep people healthy. They help people who are sick, so they go back to being healthy. Let me. I think you're. Uh, so I what I want to tell you a little bit about what I do is public health, preventing disease from happening. Um, So it's not just moms and babies. We're also interested in families and communities. And one thing I wanted to share you is this story here. So you understand a little bit of what I do and what my research is about. Let's imagine a river. And in the river, you start seeing, you're right here. This is me, this little guy with a rope. You start seeing people drowning. So you kind of try to save them, um, and save one, but then you see another one, you try to save them, save another one. This is what physicians do. When someone gets sick, they would do recommend medicines or procedures to help people go back to their health. But some people, in that case, that's what happened to me, are interested in what happened upstream. Why? Who is throwing all these people to the river? Or what's going on? What's happening? And then I walk a little bit more until I found out that the bridge between a mountain and another mountain was broken. And then that's people were walking through that bridge and there was a hole and they were falling in the river. So in order for me to really save all these people here, I need to build a bridge, and that is public health. Public health goes to the root of things, how disease happens in the communities, why people are smoking, how we can help them to stop smoking, why people get COVID. We need to find out how is it that they are getting sick, why people have car crash. Uh, that's an accident. It's another major public health problem. Why there is mental health, there are mental health issues in families. We need to go back to the roots and try to find out the protective factors and also the factors that increase the risk for disease. So this is the story. This is medicine, this is public health here. And applied to maternal and child health, then we start seeing these other picture here. There is the person, the mother, and the child, or the father and the children, but these people also live within a family. And that family also lives in a community. And in that community, you have conditions, living conditions, food available to that community, transportation, jobs. All those are called the social determinants of health. And without those, we cannot have health, really. People get sick if they live in crowded houses, if they live in polluted environments, if they don't eat right, if they take risk because they cannot afford a safer environment or safer cars or safer schools, they get injured. We need to work on the social determinants of health. But then what determines the health of our community is the political environment, the resources in the country, the policies that really help people get jobs, have good schools, and all that. So this is public health. And what we do in maternal and child health is we start looking at these three things. In the community, there might be groups that are not doing so well in maternal and child health. Like, for example, mothers that are more likely to have uh, babies that are very small or they get sicker, and also families that they have a lot of risk factors and end up getting sicker. So there are two things. We can provide programs, resources, preventive programs, or healthcare for all of them. But if you notice these three guys here, one of them is taller, one of them is mid-size, and one of them is very little. If we just provide the same care for everybody, or the same programs and the same stuff, that's still not really good because, well, they're all the same level, but some people need more. And this is what the importance of having maternal and child health professionals looking at the data. This is how I look. These three are usually bar charts or numbers that I look at, and then I find out that there is more, there is a group that is not doing so well. So some people may think, okay, let's try to give more resources to the one that needs more. That's called equity, and it's very important. But even more important would be is when we knock down those barriers so everybody can enjoy health. For example, when you knock down barriers, when you provide healthcare access, when you educate the entire community, when you make really the resources for health, nutrition, social environment, education, all of that good quality, so everybody can access it. So there are no barriers to their health. And I think that's enough on my end. Maternal and child health, specifically, what I study is I look at experiences that happened to mothers when they were children, that they were difficult experiences. They grew up in difficult environments, sometimes even affected by violence. And I look at how that affect their pregnancies and their children in the future. And I try to come out with solutions. Could be programs, could be education, could be even linking to changes in policies and laws to improve that. That's my research, specifically adverse childhood experiences and how it affects pregnancy. Yeah. Thank you.
Thank you, Dr. Salinas. That was a wonderful explanation of your career, and it really opens our eyes to all of the different opportunities that are out there. So many times students hear, well, you can be a doctor, a nurse, or a dentist, and they may not realize all the different specialties that exist. Or having heard about this tonight and what you do may open their eyes to these different opportunities. You know, that sounds like something that I'd like to do. So now we get to the interactive portion where the students get to ask some questions. So I'm going to share my screen and I'm going to bring the interview questions up on the screen. There we go. And everybody be prepared because I'm going to call on you to ask some questions. Let me make this a little bit bigger so I can see everybody. Fiorella, I'm going to have you up first. Now, Dr. Salinas has already answered number one. Fiorella, can you ask question number two, please?
Yes. Where do you work and what is the atmosphere like?
Thank you. I work at the University of South Florida at the College of Public Health. The atmosphere is great, I have to say, because one of the things that it's part of the culture here. If you have families, and let's say my children need to come with me to meetings, not anymore because of COVID, we've been working remotely. But before, my children would join me sometimes at meetings, or if we needed to miss for a dentist appointment or pediatrician, it was very good. I always have no issues with that. I have flexible time, for example. I can drop my kids at the daycare and get to work around like 9 a.m., 10. I would work still 8 hours in my own time. But the important piece is that USF makes it very flexible for me. It's a lot of professors, so we all do research and we ask questions that we try to answer through surveys or sometimes interviews. Um, and those questions are about how we can make the health of mothers and babies better. And so we need to work with community organizations, such as AHIC, for example. Yeah, it's organizations that are right there in the community.
And we are very thankful that you work with us. We appreciate that. Eva Maria, I have you up next, and I don't want to ask any redundant questions here. So looking down, we're ready for number 7. Eva Maria, can you ask number 7, please? You can unmute yourself. If not, we'll have Edith. Edith, can you unmute yourself for number 7?
Okay. What type of starting salary can a person expect in this career?
Yeah. Well, in public health, the starting salary of a professor is about $100,000 a year. So some people make more, some people make less. That's on average. If you have, let's say, a combination of clinical skills, like and also you do teaching and bring grants to the college, you may have more than that. Now, I had to say that it's not as much as pediatricians. Like as a pediatrician, I would do $200,000 perhaps, or 150, depends on where you're working. But it's very rewarding because I get to decide my schedule. I work on the community, and I don't have to do night shifts anymore. So you kind of look at, what's most advantages. Yeah.
All right. Now I saw, Mariah, that you were having some difficulties. Put in the chat if you're able to speak with us yet. Melinda, I've got you up. Can you ask question number 8, please? Melinda, there you go.
Why did you decide to pursue this career?
Yeah. And by this career, I'm assuming my last phase of my career, which was public health, or you asking me why I went into health in general.
Well, we have time for you to answer all of the above.
Okay, great. So the first thing, what made me go into a health career, it's I was little and my dad was also a physician. He's a maxillofacial surgeon. And I always admired how he was he knew a lot of stuff. But the most important piece, what really made it for me, is when I started volunteering in community programs that were health education in communities. And I really like helping people, like teaching them or with advice. And I would see in their eyes, the appreciation. And I felt really useful. Like back in the day, it was about oral health, for example. Yeah. And I really wanted to go medicine that way. I always like science as well. Although my teacher at that time in high school said that I should have been an engineer because I was really good at statistics and mathematics, but I really like helping people. So I went into health. It was the same thing that when I was practicing as a physician, that as a pediatrician, you start seeing that it's really not possible to separate the health of the child from the health of the mother and or the family. So I started becoming more interested in how to improve the whole family health. And I met a person from public health who was teaching education in the community. And I said, like, do you expect to improve health with just education? Absolutely, he said. He had gotten a master's in public health in Tulane. And I started following the population because I was the pediatrician for that population. And I started seeing the improvements in nutrition and in child health and development. And I was amazed. So you can change people's health with just education. You don't need to give them money or treatments or medicine and stuff. It turns out that it's more important to improve the social determinants of health. So I shift completely to a public health career, and it's been ever my passion. Specifically, I want to help families avoid risk of child abuse, child maltreatment, family violence, because that's a major problem for families that impact their health. That's my current focus. Yeah.
I appreciate you sharing the importance of health education. And I know that every time I do a training for future health professionals, whether they be nurses or medical assistants or pharmacy techs, I gently remind them that not just are they going to be, future pharmacy technician, but they're also going to be health educators. They will always have a chance to educate the community members that they work with. And that's an important aspect of it. So thank you for sharing that. Tabitha, can you unmute and ask question 9, please? Looks like we're having some technical difficulty. There she is. Oh, almost.
Did you face any challenges on the path to your career?
Thank you, Tabitha.
Why are you having me talk? I'm trying to do something.
Thank you very much. You know, the one challenge that I experienced is I don't think my parents still, to this day, know what I'm doing. The reason is my parents were they were thinking that a doctor is someone with that sees patients on a daily basis. It's difficult for them to understand that we work in programs, policies, helping people in the community. um, so sometimes people don't understand that those who are social service individuals or scientists or professionals of different kinds, educators, for example, the important role that they face. Fortunately, that's not the case when I actually go to the community or work with organizations. I get a lot of rewarding experiences, and I can be certain that every single day what I'm doing is making a larger scale change. That river upstream. Yeah.
What would you say is least satisfying about your career?
Yeah. Very interesting. Because I feel very happy and fulfilled in my career. But the least satisfying about my career would be that at times eh, people's the behaviors are difficult to change. We know that um, it's important to change behaviors for health, but sometimes people, even though they have the knowledge, even though they have the evidence in front of their faces, and they even get paid to do it, they still choose to take the risk sometimes. Eh, that's because they may have a history and we haven't been able to get to them in the way we are educated. That's why it's a specialty. You need to really understand the history of the persons. One example of those is smoking, for example. People know that smoking is bad for your health, yet people keep smoking in front of their children and So it needs someone from the community, other peers, who can come and say, hey, we're friends. Don't do that. Change your way. When it comes from someone it's a stronger message than it comes from a doctor, whoever, professor, and titles and degrees they have. Yeah, so that's the one thing um, that it's less satisfying. Physicians also know the same thing because you have patients who has diabetes and the sugar is very high because they ate a lot of cake this weekend and they know they shouldn't eat cake, yet they do it. So it's the one thing, but we gotta work with it.
Believe me, I understand the sentiment of wishing that people listen to you. I mean, that's across the board. I wish my stepson listened to me when I gave him advice. When I know I'm right, I just wish he would listen to me. So I understand the frustrations when you have some information that can help and somebody just chooses not to follow that advice at the time. But we still do the best we can. Now, I
And
know Dr.
sometimes they're
Salinas.
afraid. Sometimes they're afraid, like what's happening right now with COVID vaccine. People are afraid because of a lot of myths and misconceptions that they had heard, which are not true. The vaccines are pretty safe, and they're afraid of taking it. But once someone explains and they see others, their friends, their relatives taking it, they will like it come on board.
Agreed. Now, and I know you've already mentioned a little bit about, the favorite part about your career, of course, is helping people. But I think it's worth mentioning again. Would you like to expand upon the most satisfying part about your career?
Yeah. So it has two parts to it. The first is um, public health professionals such as myself, specializing in maternal child health. We are people who likes to understand before we make any recommendations. So we usually collect data or try to read more, investigate more. So that's the first step, uncovering why things happening the way they happen, tell a story, and that's very fascinating if you're really interested in learning why people act the way they do. And then the second is, okay, let's come out with solutions that can work for the people. That's the second piece, because once we do see the solutions, we start seeing those numbers going down. uh, Fewer people getting complications in pregnancy, fewer people getting into accidents, more children, um, you know, during the whole childhood and adolescent years being healthy and thriving. So that is very rewarding. And most importantly is um, I like to feel useful for my community. And that it's something that if you like it, well, public health might be your place. Yeah. Yeah.
Over the years, with all of the health professionals I've worked with, I hear time and again, most satisfying is knowing that you're making a difference, knowing that you're helping, and it's a wonderful objective to have in your
Yeah.
lifetime. Fiorella, I've got you up again for, let's see, how about number 15?
What is a common misconception about your profession?
Yeah. And I have two or three professions, right? Medicine, maternal child health, and epidemiology. For medicine, the misconception is that um, doctors are become doctors and they make a lot of money, and that's why people go into medicine. In reality, most doctors are people who are trying to help, and money, doesn't make a difference. They work in hospitals, very hard schedules, and they are trying to help. That is one misconception that I would say. In public health, the one misconception is that public health is about the environment only. You hear public health and immediately start thinking about some environmental stuff, eh, or vaccinations only. No, in reality, it's this uh, event right now. It's public health because we are opening awareness to how to help others. That is public health. Public health is also when we send disseminate messages in Facebook about something that is good and for you, for your health. That is public health. When we change laws so people can have insurance, that is public health. When you educate parents how to take care of their children, how to educate them without violence, that is public health too. So it's the misconception that is something very narrow. And in maternal child health, the biggest misconception is that it's only about mothers and babies. In fact, some people work in maternal child health in topics such as cancer prevention, but for populations that are like children, for example. Some others work in maternal child health, and it's not maternity care, but instead they work in providing family planning services. Others work with youth, males, trying to teach them role models and how to avoid violence and other things in the school settings and the community. So yeah, it's not just about mothers, it's about communities. Yeah.
Absolutely. Edith, it looks like I have you up next for number 16.
Okay. How has your profession changed in response to this pandemic?
Thank you for asking that question. It turns out that I have actually enjoyed more connections during the pandemic than ever before. There's been more interest in public health than ever before because it's really that's the career that is most needed right now during the COVID-19 because we need to look at the data, who's getting sick, where are the communities, where are the clusters of people getting COVID. We need to also do protective measures like social distancing, mask, and all that. We need to educate people on the misconceptions, and we also need to tell them about the vaccine and what comes next, while we keep everything else going well. Eh, so during the pandemic, I actually have been very busy. I had done talks about the stress that families are experiencing during the pandemic. During the pandemic, parents were very stressed, and there was a lot of conflict just because people were stressed. You know, people lost jobs. So in the pandemic, we have been very busy trying to disseminate ways for people to find help, to find resources, and how all organizations can reach out to them. So I had to say that I've been very busy. You know, this is quite common for me nowadays.
Now, before the pandemic, did you ever spend so much time on Zoom?
No, not ever. I had never used it before.
That was something else we all had to get used to, wasn't it? The new
Yeah.
technology, for sure.
But just to say about the technology, um, 2 hours ago, I was meeting with 19 individuals from different organizations, Humana, Baker, people from Waimama, from all over the county. We are able to meet now. And that has really closed the transportation barrier. Because before, it would have been very difficult for me to travel to Waimama, be back in USF and all that. A lot of time wasted just on traveling. But now we're able to meet thanks to the internet access. Like those without internet access is not the same thing.
I understand. I too have enjoyed being able to reach more students in our 4 county service area just by the ability to meet on Zoom. So some good things have come out
Yeah, so good.
for sure. Fiorella, now we're going to get in the section of, how do we get from here to there? For these middle school students and high school students who are on with you tonight, how do they get from where they are now to where you're sitting in that chair? So Fiorella, I'm going to have you ask question 17.
What classes did you take in high school that helps you now in this career?
Yeah, thank you very much. I would say there were um, there were 3 classes in high school that really influenced me, and they are still very useful to this very day. The first one was my class on natural sciences. That class inspired me for going into science stuff. You know, why the water evaporates, all that kind of opened the way to try to understand the laws of nature and how also, we can explain things. Hypothesis. That was the first time I heard about hypothesis. Now I formulate hypotheses and I test them every day. Second was biology. In the last course in high school, biology. And that's when we started looking at the connection between humans and the environment and how it affects our bodies. So we're not really disconnected from each other. And COVID demonstrated that, something that was happening across the world, that it ended influencing us here. So that's the same thing. Nature is connected. And the third class, it was mathematics. The fact that I really like numbers because I want to know the rates of things and try to understand what predicts something. Um, that helped me a lot. So those three classes, but the most important I would say was natural sciences, the love for sciences. Um, I think the same skills that I learned in that class are the same skills that I'm now using. Obviously, I learned more tools along the way, but I formulate a hypothesis. I come out with the possible ways to test that hypothesis. I gather evidence, and then I make my conclusions. That is what I do every single day as I conduct research in maternal and child health. Yeah.
Well, I would like to thank you for dispelling the myth that some students have, and I know I had myself sometimes when I was in high school, is, why am I learning this? I'm not going to use it in the future. But yet you do, don't you?
Well, I thought about that mathematics first, but once I got into public health and started learning about epidemiology, the importance of looking at the numbers and the data, I said like, my goodness, I learned all these like in high school. And now I'm using it. Yeah. Yeah.
Edith, I've got you up for the next question. This is a loaded question. Question number 18 for Edith.
What kind of student were you in high school?
What kind of a student? What do you mean? Was I a nice student, or are you talking about my grades?
However
Because I
you
was
would
very
choose
nice.
to answer that.
Well, I was a student that was very active also in high school. I belonged to groups in the school that we have like particular interests in. I belonged to the chess club and volleyball, and I had a lot of friends. That was on the social side. So I really enjoyed the interaction back then too. Now, in terms of grade, I had to say that I graduated as the first student in the whole graduation. I was, I believe in the United States, it's called magna cum laude. Um, and in my high school, it was called the best student. So I had the I'm an exception there. Um, in my PhD, I was also my valedictorian. That's the student that give the speech to everybody in the commencement. Um, I guess you gotta like it. So if, in my case, love of learning, it's a strength. If you heard about personal strengths, love of learning is one of mine. So if the day I don't learn something, I feel bored. So I enjoy learning something new, even if it's something about, I don't know, cats. It kind of feeds my life into it. Yeah. So I'm in a work environment that I'm always learning something new, and that gives me quality of life. It's very important to match your personal strengths with the type of environment.
Now, when students are trying to plan for their future, their career path or a path to colleges, they know good grades, good test scores. How important are extracurricular activities, and what type of extracurricular activities would you recommend to help them get into college?
Thank you for that question, because that's something we know in public health, that grades are important, but they do not tell us a lot of things that we want to know. But extracurricular activities, community involvement, passion about a particular social cause, that's the kind of students we select in master programs and in PhD programs, because we know that they have determination and passion for what they're doing. And for example, I have students who had previous volunteer experiences helping in the YMCA, and they wanted to do a career in adolescent health. So that tells me a trajectory that is of interest. Sometimes we only have students who are super bright because their grades and the exams are great, but they don't have the passion and commitment to it. And it's more important, to be honest. That's why I said I'm kind of a section because I really my grades were very high, but in reality, uh, that's not really a determinant. It's more important to have that passion and commitment, because when you do something you like, you're gonna be good at it. Yeah.
Agreed. I do an exercise with the students of, okay, when you get graduate and you think, all right, I'm going to go out and get that job. And then pretty soon it's, well, how long am I going to have to do this job before I retire? And you start counting up the years there, 40, 50 plus years to have a job. You better like what you do, because you're going to be spending a lot of time doing that job for sure. Now, I know that you're a medical doctor. You've also got a PhD.
Yeah.
Is that needed to have a career in public health? What other tracks can you take for
Yeah.
public health careers?
In fact, there's people in public health that don't even have a degree. They're community promoters and community educators. In fact, there are a lot of people in public health that don't even have degrees in public health, but the life brought them to public health, and they became public health professionals based on their experiences. Um, People with degrees in public health obviously have a structured education, so they know the tools of the trade. Um, but in this particular field, experience is more important than having a degree for XYZ university. So we always tell the students that when they're taking these classes in public health, also try to learn from community experiences. And that is very valuable. Yeah, I cannot lie about that. Now, a PhD program is only for persons who wants to do research, as that's their life, wants to do research. So you don't have to do a PhD if you want to work in public health. But a master's help, and obviously college education help on all of that. Um, but if you want to do research, like or teach at the university level, a PhD usually is necessary. Yeah.
Thank you for explaining the difference between PhD and MD, because I know sometimes the alphabet soup gets a little confusing to understand what they need and how far they have to go. Fiorella, I've got you up next. How about question 22?
How did you pay for your education?
Thank you. I did not. I did not pay for my education much. You always pay something, but um, I went to medical school that was subsidized by the government, and if you get accepted based on your scores, you get paid to entire medical school. To study masters in public health, in maternal child health, I obtained a scholarship from the Fulbright program, which is a U.S. Department of State scholarship, and I studied masters. For the PhD program, if you're admitted to the PhD program, the school actually pays for your first 2 years. And the other 2 years, I was already working and doing research, and which helped pay my costs. So it's an exceptional pathway, because most people have to kind of find ways to pay for college and masters and all that. But I'm telling you, there are lots of scholarships out there, and there are lots of opportunities. If you really want to pursue a career in health sciences, there are supports. And I know a lot of people have studied with, and they don't need to be rich to afford that. Now, medical school in the United States, it's a little bit more expensive. I know that, but again, there is financial aid as well.
Absolutely. And that's important for students to know, especially those of you on this session tonight who are getting ready to graduate and wondering, how the heck am I going to pay for college? Scholarships, scholarships, scholarships. Apply for as many as you can. Chances are you aren't going to get all of them. So I always recommend apply for at least 20 scholarships. If you get 5, if you get 10 of them, that's more money than you have in your pocket right now. So why not get that free money for
And I'd like to
college?
mention something about healthcare professionals. Physicians and nurses in the United States are not that different, actually, because they both see patients and they both get paid well, but there's a difference in the way the education is. If you go nursing, you can study and work at the same time. And you do nursing first year, you get your license, your LP license. Second year, you get your RA license, and 2 more years, you get your Bachelor of Science in Nursing, and then you work and you study. So that is, if I didn't get any scholarship, I would have gone that way, um, because I could work, pay my education, work, pay my education. And at the end, nurses, as advanced nurse practitioners, they get licenses to prescribe medicines just as family practice physicians. So I wanted to mention that as well, that it's not the only different choices. Healthcare is very broad, a lot of professions out there. Not just
Absolutely. And there's critical shortages across the board for all health professionals, but particularly in the nursing field. And nurses can specialize in public health,
oh yeah,
maternal and child health, epidemiology.
absolutely, yeah. Some of my best professors were nurses. Yeah.
Wonderful advice. Edith, Edith, you get to ask the last question, question number 23.
What is your best piece of advice for students interested in this career?
Yeah. Very good. So the best piece of advice that I would do is, um, right now that it is that you are a student right now in high school, get involved in projects about health promotion. That will teach you what it's like to do that. And then you will meet other professionals as well, other people who are working in different public health environments, and they can give you tips and they can tell you what it's like. There is no public health professional identical to the other. We're not alike. Everybody has a unique path. So you build your own path. And it's a discovery. It's a discovery process. That's what I would do. At this time in high school, middle school, you can get involved in health promotion. And if you like it, you're going to start discovering wonderful ways to get involved. Yeah.
Excellent advice for the future. We are nearing the end of our session here, so I'm going to allow you some time, students, to ask any questions that maybe we haven't gotten answers for. And I know that some of you are shy, so please feel free to write your questions in the chat. We can always read them from the chat field. And while you're thinking about any questions that you may have, I have a poll to put up for you on the screen, the evaluation poll, so you can let us know what you thought about tonight. Here comes your evaluation poll. Please answer those questions. And again, please feel free to type any of your questions into the chat field.
Would you like me to post the USF site for a program in case they would like to explore more?
Sure, absolutely. Do you still have access to share? You should.
Yep.
Okay.
This is this maternal child health at USF. Let me just post that.
Wonderful. I saw it come up in chat there. We have a question for you in the chat field. What is one success story you've had with a family? Can you share with us?
A success story, yes. I mentioned that some of the ways that we do public health is to have parent education, to improve how they parent their children. So there was this program called Helping Our Toddlers Developing Our Children's Skill. That's a program, Public Health Create programs. And we taught parents how to address challenging behavior. So I remember the first cohort of parents, and one of the mothers came and said, like, I'm able to enjoy being a mother again thanks to this class. How can I help? So I told her, well, if you really want to help, maybe you can join us for the next round of classes. She helped and became a trainer, and she actually decided to go into public health. So that was kind of very interesting for me to see how when you do good, it kind of it multiplies. Uh, People will be inspired. And now she works at USF and she has a child who is almost a teenager now. But that was a very rewarding experience. One of many.
One of many. Thank you for sharing that. We have some more questions coming in for you here. Um, Melinda wants to know, what was one of the obstacles that you had to overcome?
Yeah. Well, one of the obstacles you have to overcome is that, particularly in medicine, is well, you have to be able to sacrifice some things to get your dream. That means that sometimes there will be some weekends that your friends are going to the movies, but you're learning about anatomy. Other weekends, people are going to the pool, but you're going to, be studying diseases and how to treat them. Um, so that is a challenging, but at the same time, for those who have gone through that challenge, is very rewarding, and it's a life commitment. Um, and that kind of follows me in the subsequent paths. Um, you know, it's worth it. And you can always watch the movies afterwards on Netflix nowadays.
That's right. You can always have them on demand later on.
Yes, yes.
Now, if the students are wondering maybe how they can get involved right now in middle school or high school with public health programs, what kind of public health programs are in schools? The first one that comes to my mind is SWAT, Students Working Against Tobacco. What are some other programs, Dr. Salinas, that they might get involved with, in school?
Yeah. Well, there are many, many programs, many organizations in Tampa Bay, from the health department, AHIC, and also other organizations that do education like Healthy Start, Head Start, the Children's Board, Family Resource Centers are always looking for volunteers. But that's because I'm an MCH. You may be a public health inspired person who likes to do environmental stuff. So getting involved with environmental initiatives like planting trees or helping the environment, decrease pollution, recycling, it is also public health. Those are called environmental health specialization of public health. We also work with them. So there are many, many ways. I can actually share a resource from the schools of public health, how public health works in different areas. But just think about everything that you do to keep healthy. It's public health. Nutritionists are also part of public health because they work helping with the healthy diets and nutritious foods. So that's also another area. Um, it's kind of limitless, and I wouldn't need to know what the student um, like for example, if they like to work with people, try to with groups of people in the community or other peers, then there might be programs for children where they're peer to peer. If they like more stuff about like the environment, then there might be some other things. So I would need to know more, but they could. Yeah.
There's certainly a lot of them in whatever community that everybody's from, whether it be from Hillsborough County or Manatee County, Sarasota County, DeSoto County, Charlotte County. We've got students from all over on the session tonight. And tonight is the last career chat for this school year. So thank you, Dr. Salinas, for joining us and ending it on a high note. We appreciate that. We will be bringing career chats back for next school year. So probably October. Students get settled about October. So look for that information, students, to come out again. But never fear, we're always doing something over here. I posted in the chat about our virtual health careers summer camp that's coming up. So please, students, look in the chat. There's a link to the virtual health careers summer camp application. And even though we give priority to students in Charlotte, DeSoto, Manatee, and Sarasota counties, We are accepting students from all over the state of Florida this summer because it's a virtual summer camp. So we can is the answer to that. You don't have to drive down to Sarasota. We're doing this on Zoom in June, June 14th to 18th. It's just 1 week, just on Zoom for 2 hours a day each day. So please, if you're interested, fill out that camp application prior to May 14th. And we'll be talking more about public health when we have that summer camp and a bunch of different careers that are available to you. We are partnering with Blake Medical Center and talking to the various healthcare professionals that work there. So that's going to be a fun time this summer. Did anybody have any last questions? We've got 1 minute left for Dr. Salinas, or any parting words for us, Dr. Salinas?
Keep up the good work. Follow your dreams. You may find people who don't understand you at times, but follow your dreams, and there is a path for everybody. And the path may be in public health or somewhere else, which is perfectly fine.
Thank you. And that's why we like to do these career chats, to help students explore, because they're going to hear about careers they've never even heard of before. So how can you possibly know what you want to be when you grow up if you don't even know what's available to you out there? So thank you, Dr. Salinas, for spending time with us tonight and telling us about your wonderful career. And we thank you for all the work that you're doing out in the communities.
Thank you very much for having me.
Thank you for
you,
being
everyone.
with us. Yes, it was wonderful, Joan. Once again, did a great job. And thanks for all the students for attending tonight.
Thank you. I can see the students are writing in the chat. They're thanking you, Dr. Salinas.
Mhm.
Thank you, everybody, and have a good evening.
Okay,
At your
Thank you.
service. Bye-bye.
Bye-bye.
Bye-bye.